criminal justice system. We need new laws to strengthen transparency and accountability in law enforcement. We need to ban unnecessary and excessive uses of force, including chokeholds. And we need to end the militarization of local police departments. I was pleased to see both the city and the county of San Diego's recent announcement that they are stopping the use of the carotid hold, as well as recent statements from the Peace Officers Research Association of California. For those that have not heard of PORAC, they're the largest police officers association in the United States, over 77,000 people. They actually submitted testimony to the House Judiciary Committee today. You may know that the Judiciary Committee is discussing police reform as we speak. And this is the largest police association representing 77,000 in California. And I quote, "The tragic and unnecessary death of Mr. George Floyd in Minneapolis is simply inconsistent with the mission, standards, and goals of law enforcement. We are sickened by what we saw. As peace officers, our role is to serve and protect, a responsibility that we cannot fulfill without the trust of the communities we have sworn an oath to protect. When that trust is broken by officers whose actions are inconsistent with the mission and goals of our profession, we too are outraged, and we have a duty to intercede, an obligation to speak out, and a moral imperative to hold those officers accountable. Our nation has an opportunity to channel this righteous anger into action and lasting reform. That is why we feel compelled today to submit this testimony. PORAC recognizes the real crisis of confidence in law enforcement among the communities we serve. It is on us to work with our communities, lawmakers, and other stakeholders to repair that breach in trust." That gives me hope. That gives me hope that during this terrible time, that we might be able to come together and get something done. So what are our next steps? What are we working on in Congress? Well, last week I announced my co-sponsorship of the Eric Garner Excessive Use of Force Prevention Act, which was introduced by my friend, Representative Hakeem Jeffries of New York, that would prohibit the use of chokeholds by law enforcement all across the nation. We're also moving forward on the Commission for the Social Status of Black Men and Boys, which was introduced by Representative Frederica Wilson. And then on Monday, Congress introduced the Justice and Policing Act. This is a big, comprehensive piece of legislation. And I'm proud of the work of our Congressional Black Caucus, my dear friend, Karen Bass. I think they've done an incredible job trying to meet the moment that we're in. And I'm still carefully reading every word of this bill. We're talking to a lot of our local stakeholders, but I am strongly encouraged by that statement from PORAC today, some of the other conversations that I've had, and I'm hopeful that we're actually going to be able to not just talk about it, but do something about it and work together and hopefully see a better day. And the discussions are ongoing, but I thought I would mention some of the proposals in the bill. Limiting the transfer of military-grade weapons and equipment to local law enforcement, making it a federal crime for police officers to commit murder or manslaughter, giving the federal government jurisdiction to bring charges against an officer if the state fails to do so, developing a national standard regarding use of force training and recruitment. And that idea of a national standard, in fact, is embraced by the Peace Officers Research Association of California, and I strongly support it as well. Just to be clear, I don't believe that our police force should be abolished or defunded, but I do support significant reforms, including an end to the militarization of local police departments, more funding to improve relations between law enforcement and communities of color, and funding to help diversify police departments. And I also think, in addition, we need more funding to have programs that lift up underserved communities. And I've been engaged with dialogue with both the civil rights community and the law enforcement community in the past days. And I know we're only going to be able to make positive change if we can have a dialogue and if we work together. And my great hope is in the days ahead, we're going to continue to stay safe, and we're going to use this opportunity to create a new normal, to hear the voices out there, and hopefully do so with compassion and with a sense of improving our society for those who need the help the most. And before I go any further, I want to introduce Dante Pride. Mr. Pride is the founding partner of the Pride Law Firm in San Diego. He's got the logo right behind him, looking good. He earned his bachelor's degree at Morehouse College in Atlanta and graduated from the University of San Diego School of Law, where he was the vice president of the Student Bar Association. After practicing employment and labor litigation, Mr. Pride started his own firm based on the idea that injustice anywhere is a threat to justice everywhere. And most importantly, he is a constituent of the 49th District. And I'm grateful that he is. It's great to see you. As we watch and we participate in the protests and the vigils to honor the life of George Floyd, including one, Dante, that you helped to lead the other day that I was at, I had a chance to hear about your personal story and your experiences growing up in San Diego, living in our community, serving our community. And I think it's a message that was powerful and something that I wanted all of our constituents to hear. And that's why I had you on today for our town hall. And I wanted to turn it over to you, Dante Pride. Thanks for being here.
All right. Thank you, Rep. Levin. I am excited to be here. This is my first time with the congressman. So thank you for that. I do appreciate it. I'm also happy that my message did not fall on deaf ears. As I said at the protest, it's been a message that I've been saying for years, and there's just been no reception. But now in the space that the world is in, our nation, there's some reception to it. And I believe that people haven't heard this story. And so it's a good story to tell. So let me take you back to where I'm from. Born and raised in San Diego, California. I went to high school at a school called Morris High School right here in San Diego. I actually was Morris Man of the Year my junior year of high school, whatever that means. It was a pageant of some sort. So I was a kid that did good in school. I did well in school. I did everything I was supposed to do. I never got in trouble with anyone. I got great grades, did well on standardized tests, got a full scholarship to college, went off to college, came back to law school. Now, in the midst of this achievement of me doing well, I have had multiple run-ins with police. And most of the time, it's of no fault of my own. Sure, there have been times when I was speeding or I made an incorrect turn and I was ticketed for those things. But by and large, I am pulled over at a rate of about once or twice a month. And often there's nothing that I'm pulled over for other than, in my opinion, being Black while driving. And this experience has been an experience that I've spoken with my mom and my dad about, and it's been a hurtful experience. And so it's an experience that's shared by many people in my community that look just like me. And over time, I've come to realize that regardless of me doing the right thing, of me doing well in school, of me not getting in trouble, at the end of the day, this skin that I'm in makes me a suspect. I actually had a conversation with a friend whose husband is a police officer. And we had this conversation about 4 years ago. And I'm not going to name the officer because I understand the conversation was made in confidence. But this officer said to me, if I saw you driving in a nice car, I would pull you over. And I said, but why? Mind you, this was in the context of me complaining about being pulled over all the time. And he says to me, if I was a police officer, I would pull you over too. And my question was, but why? He was like, because you're Black and you're driving a nice car. So you could be a drug dealer or you could be a pimp. And I was dumbfounded. I was floored. And that's just been the experience that I've had with the police in this country so far. And then there's one specific story that really stands out in my mind about when I believe my belief in the police system and policing kind of turned just a little bit. I was a 14-year-old kid. Again, I was an honor roll kid, never in trouble. I never did drugs. I don't drink still to this day. I don't do any drugs, illegal drugs whatsoever. Never have, never even experimented, right? Weird, but never even that. And I'm at a park with some friends and a police officer walks up. And the police officer identifies himself. I'm an officer. What are you doing here? And, we're just at the park hanging out, just chilling, for lack of a better term. The police officer reaches out and grabs my arm. At the time, I had a broken wrist and a cast on my arm. So the police officer grabs my arm and says, oh my gosh, is that a weapon? Picks me up, slams me on my head. And I have this big, huge knot on my head from the police officer slamming me on the ground. And he said that since I stood up when he walked over, he felt as though that was aggressive. I'll never forget, I went home crying to my father. I told him what happened. My dad, military man, retired 27 years. Sorry, Dad, if I got that wrong. 27 years military. So he was obviously upset. First thing my dad did was take me up to the police station and to file a formal complaint. And when we went up there to the police station, we weren't received well. We were made to feel like suspects in some crime. And I'll never forget the way that felt and that feeling. And that feeling is something that a lot of people don't get. A lot of others who don't look like me have never had that experience. All their experiences with police are nice and respectful and formal. But when you're from the inner city, like I was and I am, it's a different experience. And so that's the issue that the world is taking notice of now.
Thank you so much for sharing that, Dante. I'm grateful that you're here. And we had a few questions from our audience on some of these rallies and protests that we're seeing in our communities all across the country. So I wondered if you'd stick around and help me address a few of these.
Oh, absolutely.
Thank you. First, Ariana in Oceanside asks, what efforts are being made to inform the public of the adverse effects of racial discrimination and to seek its elimination? Well, Ariana, thank you so much for that important question. You know, it's one of the main reasons I wanted to talk about it here today. I think we need to use this moment and meet this moment to address the systemic racial injustice in our society. And it's also why I support the peaceful protesters around the country. I think for me, as somebody who, did not have to experience the experiences that Dante was just referring to, I think it's important that I listen with compassion, that I try to understand what it means to be Black or brown in America, and know that it's something that I will never experience, and know that the inequity is huge, and it's something that needs to be addressed. But one of the other things we can do is all come together, regardless of our backgrounds, in peaceful protests and show our solidarity with those that are fighting racial injustice. And that's where Dante and I were the other day in Cardiff. Dante, do you want to share anything more about our experiences out there?
The experience in Cardiff was amazing. Again, like I stated that night, I've been in this space, in this fight for my entire life. It's what motivated me to move and open my own law firm and do what I'm doing. And so to have people that don't look like me join in and see, it's finally a feeling of like a waiting to exhale. I'm exhaling now, like, okay, we are here. You are here with me. We can have this conversation and we can decide together how to move forward from here.
Thank you, Dante. Michelle asked, what direct action are you taking to reform the corruption in our law enforcement and provide equal protection of all Americans, specifically Black Americans? Well, thank you for that question. As I mentioned, thoughts, prayers those are good things, but they're not enough. We have to take action. So my hope is that the Justice and Policing Act, along with some of the other measures that I mentioned before, are actions that will help our community. And then hopefully engendering a dialogue of people, both from the civil rights community and the law enforcement community. I think we're fortunate that in California, we've got folks in many cases that are more progressive in the law enforcement community that are willing to engage in that dialogue and have that discussion. As I just mentioned, the largest police association in California, and their written testimony today, say they recognize the real crisis of confidence in law enforcement, and they want to be part of the solution. So I think we have this great opportunity, as they said, to channel this righteous anger into action and lasting reform. And that's what we're going to work to do in the days and the weeks ahead. And it's, things like the Eric Garner Excessive Use of Force Act, the act that my friend Hakeem Jeffries has been working on for a number of years, that I think we finally met that moment where we can get it over the finish line. And I hear that the discussions are ongoing in the Senate as well, where we're going to be sending them legislation in the coming days and weeks. And I hope that they come up with something comprehensive on their side, and we're able to work in a bipartisan way and get something on the president's desk that will do some good. Dante, anything to add on that one in terms of specific actions?
Yeah, I think another specific action that we should take and we should think about from a nationwide standpoint are community review boards. The specific precinct should have community review boards with teeth. There should be some type of maybe termination or demotion that can occur if the community review board finds that you have conducted yourself disrespectfully, not with excessive force, just disrespectfully. I think that policing should be from a standpoint of every potential suspect or criminal should be treated like your supervising officer having committed the same crime. If we can get to that space, then I think people will feel trust back in the police departments. Because as of now, the trust is lost. You don't hear people saying, forget about the firefighters. It's only about the police, because the trust with the firefighters hasn't been lost like the trust with the police departments have.
Thank you for that, Dante. Another question from Teresa. She asks, many of us wonder why peaceful protesters do not return home at curfew after they have spent hours doing a beautiful job of making their voices heard. It seems it would be much easier to keep our communities safe from bad actors if peaceful protesters return home at curfew. Well, I thank you for that question, Teresa. I think my own opinion of it is that we have to take a hard look at particularly the very early curfews. I think they prompt some unnecessary and, frankly, avoidable confrontations that don't have to happen between law enforcement and peaceful protesters. And I think at the end of the day, we've got to respect and appreciate the First Amendment. The First Amendment is so critically important to our country, to our democracy. And I never want to see a situation again where peaceful protesters are shot at with rubber bullets or pepper balls or whatever else. This is America. We have to allow peaceful protests in the United States of America. And I don't think anybody supports the very small number of individuals who, take advantage of situations to commit acts of violence or, trying to otherwise, define a peaceful protest. But I was just encouraged that in our communities, the protests that I saw were overwhelmingly peaceful. And I wish it were that way everywhere. And, obviously, I'm very grateful for that partnership between our local community leaders and local law enforcement to make sure that things stayed peaceful here locally. Anything to add on that, Dante?
Yeah, absolutely. So what we saw, Rep. Levin, when we did our protest in North County is we saw a different type of policing, right? In North County, San Diego, police officers talk with the community. They're friendly. They're friends of the community. They protect and they serve. In the inner communities, it doesn't feel that same way. The same time we were having our protest in the North County in Cardiff, there was a protest in South County in San Diego. I received calls from people who were pulled over, pulled out of their car, searched. The only reason was they said, oh, well, you were a part of a protest. We just want to make sure you don't have any weapons or guns. Had that happened in North County, it would have been an issue. But having happened in South County in the inner city is not an issue. And so that is the issue that we're talking about here today.
Well, Dante, thank you very much for your words. Thank you very much for your leadership on these issues. And it's an honor to get to serve as your member of Congress.
Thank you.
I'm grateful for all the good work you're doing in our community. I know you have to go because you actually have a day job.
Yeah, a little bit.
but just know that we appreciate you very much, and we hope to have you back on sometime soon. And thank you. And again, the idea of starting a law practice is hard enough, but one that is focused on trying to change things for the better, that is indeed a noble pursuit. So we're grateful for you, Dante.
Thank you very much. Happy to be here. Happy to have you as a representative. Thank you.
Thank you so much. All right, Dante Pride, thank you so much. And now on to just another minor issue of the day, COVID-19. Obviously, Dr. Steinberg, we appreciate you. Dr. Karl Steinberg has joined us before and has a lot of fans in our district for his great work. Obviously, let me pull up your bio, Karl. I've got it. Let's see, here we go. Dr. Karl Steinberg, my goodness, nice to see you. He has a undergraduate degree from Harvard University, went to The Ohio State University College of Medicine, completed his family medicine residency at UC San Diego. He is a nursing facility and hospice medical doctor, and those facilities have been in the news in a big way. And of course, we're grateful to have him back to talk about COVID-19. And I wanted to give a quick update on COVID-19. We passed, tragically, the 112,000 mark in terms of those that have lost their lives. We're all shaken by that statistic. And it's unfortunately now around 2 million cases in the United States. California, we have close to 138,000 cases, 4,779 deaths. San Diego County, 8,729 cases, 301 deaths. Orange County, 7,737 cases and 198 deaths. However, over the last 14 days, Orange County has actually had more cases and more deaths than San Diego County, despite the fact that Orange County has consistently been testing fewer people than San Diego County. And the relatively low rate of testing in Orange County continues to be a concern of mine. As I mentioned in the past, Congress has passed several major bills dealing with COVID-19. I won't go through all the details of those bills, but to suffice it to say that we have more work to do. And the HEROES Act is sitting on the desk of Mitch McConnell. That bill, you may be familiar with, includes over $875 billion for state and local governments, including about $300 million that would come to the cities of the 49th district. And significantly, the past funding that we've done in Congress, the CARES Act, did not include any direct funding for those cities that are under 500,000 in population. I had a great discussion today with several of our North County San Diego mayors. I'll be speaking later this afternoon to some of our other mayors in the district, and each of them has been unified in the call for more federal support. Our states and our cities are hurting. Their budgets are hurting, particularly things like transit occupancy taxes, and other cities that are heavily dependent on tourism need more help. Our schools need more help. I was just on the phone this morning with one of the superintendents of our largest districts, who told me that the need for planning and reopening in the wake of COVID-19, meaning social distancing and testing and all the other things that they need to do at the district level, will cost at minimum $3 to $4 million of additional funding that they won't have from the state of California. So long story short, we need to do better. We need to do more. We can't take a pause. The pandemic is not taking a pause. The economic situation, well, we think may have improved. The most recent Bureau of Labor Statistics report says 2.5 million jobs came back in May, and that's a positive and encouraging thing. But make no mistake, I don't think we're out of the woods, and by any stretch of the imagination. And I think that we have a long way to go. If you saw the Fed today, they projected unemployment will remain 9.3% throughout the end of the year, at least 9.3%, and then we'll have impacts on into 2021. The CBO recently estimated that we'd have about a $15 trillion hit on our GDP between now and 2030 as a result of COVID-19. So we have a lot more to do. We have a lot of questions from you. And with that, I am very grateful that Dr. Steinberg is here. And Dr. Steinberg, do you have any introductory comments about where we are with COVID-19 this week?
Yes, thank you. Thanks for having me back. And I wanted to welcome Mr. Pride to the town hall, say thanks for sharing his personal story and for the work that he's doing. It's very important work. Also, I've been up in the mountains for a few days, up in the San Bernardino Mountains, and we've seen so many small town protests, just like what we saw in North County, but all over the country. And I've just been so heartened by that. It almost gives me hope that, something good is going to come out of all this. And I was particularly moved by some of the video from Philadelphia with just a humongous crowd, all peaceful. And also Portland with all the protesters lying down on that bridge for 8 minutes. So I just wanted to acknowledge that. At the same time, I'd like to say, I hope all of those people in these protests, and we had one up here in Blue Jay, it's just a tiny little town outside of Lake Arrowhead, probably about 100 protesters, all peaceful. But I hope that if any of our listeners here are planning to participate in more protests, that they are safe, and that if they do go out into these kind of group settings, that they are considering the risks and wearing a mask and those types of things. It's a little disappointing to see that Orange County is catching up to San Diego County in the number of cases. And I think this pandemic is far from over. Again, it's a matter of personal choice to some extent, to what extent you want to comply with the recommendations. But there's no question that social distancing, use of a mask, and all the routine hygiene measures are effective in preventing the spread of this illness. We have seen a continued sort of influx of cases from south of the border or at the border, including many U.S. citizens and U.S. residents who are not surprisingly coming up to get their medical care here. I guess on a positive note, the testing that initially was mostly done by taking a swab and ramming it way down into your, almost into your brain, which some of us have experienced and didn't care for too much. There's alternative testing using saliva and just a nasal swab or throat swab that are close to just as accurate, and none of them are 100% accurate, including the one where they're ramming it way up there. So that's if people are considering getting tested, now that testing's more available, it's also somewhat less invasive. So that's a little piece of good news. And I think that's about all I have.
Well, that's good to hear, because having the swab up in my brain was not something I was particularly looking forward to. But and also, Dr. Steinberg is a proud CA 49 resident of Oceanside, so we miss you in Oceanside. And I hope you are heading back from the mountains soon.
I'm actually still in the mountains, but I'll be back tomorrow.
Excellent. All right, we miss you. We have a ton of questions, so I'm going to get through as many of these as we can. And for those that we don't get through, I apologize in advance, and we'll get through them hopefully next week. Joyce asks, and this is for you, Doctor, does home isolation actually work? When one person in the home begins to show symptoms or is sick, can you really protect yourself by isolating, or is it just too late by the time they show symptoms? It is very difficult logistically to undertake home isolation, not to mention the mental stress of locking oneself in a single room for 2 weeks or even a few days.
Yes, well, it can be done, but as you said, it's really challenging. And if there is a person, especially a high-risk person in the home, that person, it's most important to protect that person. Certainly wearing masks, and if you can get medical grade masks or an N95, that probably makes things even better. Obviously, disinfection of household surfaces, maintaining as far a distance, more than 6 feet if you can, at all times, doing hand washing all the time, and just preventing touching your face. Those types of things are clearly effective. And I know a number of people who have had to do home isolation, where one person is sick and other people are not sick, and has not wound up with anybody else getting sick. So if you're in that situation, I'm very sympathetic. And if there are other alternatives, I mean, people can go stay in a hotel if you've got the resources. But people are doing it. They're doing it successfully. And I wish you luck if you're one of the people doing that.
Thank you, Doctor. Laura in Encinitas writes, parents are bearing an especially heavy burden during this pandemic with schools closed and childcare limited. At the same time, we keep hearing about childcare providers going out of business because of the lack of kids and the expensive adaptations they must make, such as extra cleaning, small group sizes. What will you in Congress do to shore up the childcare system so that parents can go back to work when the time comes? Well, Laura, I can relate to this. We have 2 young children in our home. Our second grader and our kindergartner just both graduated last week from their schools. They did so after having done distance learning for the bulk of their March and April and May. And I was really grateful to the teachers for doing just a terrific job. But your point is spot on. We included $3.5 billion in emergency funding as part of the CARES Act. That was our bill back in March for the Child Care and Development Block Grant Program. But it's not enough. And we added an extra $7 billion into that same program. At least we proposed it as part of the HEROES Act. The HEROES Act is that bill that I've referenced many times that is sitting on Mitch McConnell's desk right now that we desperately need the Senate to act upon. And I'll continue to advocate for more funding for our child care. We also have a number of child care centers that are getting funds through the Paycheck Protection Program. We recently made revisions to the Paycheck Protection Program, trying to make it more accessible for more small businesses. That would include child care centers. We increased the repayment period from 8 weeks, or the use period from 8 weeks to 24 weeks. We increased the term of those loans from 2 years to 5 years, and we changed the percentage of funds that have to be used for payroll and overhead from 75% in the initial bill to 60% in the revised bill. So that PPP Flexibility Act actually passed the House and the Senate, was signed into law last week. But we have to continue to think about how we can provide additional support because you're absolutely right. It's impossible to expect parents to go back into the workplace if their children don't have childcare and if they have restrictions on being able to go to school and things like that. So I'm with you. Ken in Leucadia has a medical question for Dr. Steinberg, but it's not an easy one, but we'll see what we can do. Can you tell us the latest news about development of a treatment for COVID-19? There's a lot going on, so go for it.
Thanks. Yeah, I'll try to not drone on for too long. First of all, it's important to understand that there is no approved or proven treatment for COVID-19. So there are a lot of things, as you might imagine, with the pharmaceutical companies and vaccine makers in the works. So I would say there's basically three types of treatment. One is preventive, right? So prophylactic. This would be something that you would take to prevent getting sick. A vaccine would qualify under that. There's work being done on vaccines. To me, it looks fairly promising, but I'm not really an immunologist. But from what I hear from my colleagues, there's a decent chance we'll have something like that sometime early next year if things go as planned. But there are always a lot of things that can go wrong. So, I'm not holding my breath for that. Other types of preventive would be taking an antiviral, like what we do with when we have an influenza outbreak, like in one of my nursing homes, let's say. We give everybody on that floor or on that wing Tamiflu to prevent it, so that if they do come in contact with the virus, they're less likely to get sick from it. If they do get sick, they're not likely to get as sick. Then there's sort of curative treatments, right? So these would be antiviral medications that actually kill the virus. The main one that's being worked on now, or that's being studied, is remdesivir. It's been around for a while, and they're using it in local hospitals in Orange County and in San Diego County. It looks like it does shorten the duration of illness. It's not like a real game changer, shall we say. But it looks like it's going to be a helpful drug. It has not actually shown a decrease in mortality or death from COVID-19, but there's a trend towards it. It looks like it's at least somewhat helpful in severe cases, and it's definitely helpful in more sort of mild to moderate cases, at least from the early studies. So that's available in limited quantities, and all of the local hospitals have gotten a supply of it. Not everybody who has COVID-19 gets it, but a lot of people are getting it, and it seems to be well tolerated. It doesn't have a lot of dangerous side effects. Contrast that to the chloroquine and hydroxychloroquine. And I do want to mention that some information came out this past week that the study that you may have heard of a few weeks ago indicating that it was causing more harm than good and that there were a lot of deaths. The study may have been flawed. Since this is such a political issue, people who support the use of hydroxychloroquine, perhaps because of their politics, are really happy and sort of saying that it's still a good drug. I would never prescribe this to somebody off-label unless they were participating in a clinical study. There's some reason to believe that it could be effective, but it clearly has some significant side effects and that sort of thing. We're also using convalescent serum, right? So people who've had the coronavirus, now they have antibodies to it. They take the plasma and give that to people, and that seems to help kill the virus. So that's being used in our local hospitals as well. And then finally, there's symptomatic medications, right? So that's medications that are used that don't really alter the course of the illness, but are to make people feel better. And we have lots of things like that. There's bronchodilators, like nebulizer treatments and so on, that can help open up the lungs. There's cough suppressants. There's also this sort of immune system storm or cytokine storm. And a lot of hospitals are using steroids, as an anti-inflammatory in severe cases in the ICU. I'm not sure that it's been determined that that's helpful, but at least anecdotally, some of my colleagues are telling me that that does help. And then, of course, we've got things like morphine, and which is really good, not just for pain, but for shortness of breath. Other sedatives for people that are on a ventilator. Of course, you probably don't want to be conscious with a tube down your throat and a machine breathing for you. So that's a kind of a nutshell version of what's going on right now in treatment. And there are other antivirals being studied as well. So it's a moving target. And I sure hope, I'm sure like everybody, that we come up with something that's safe and effective and soon.
Thank you very much, Doctor, for that comprehensive answer. And I want to thank also all of our local companies in North County and throughout the district that are working on treatments, along with trying to improve our diagnostic technology and, of course, working on the vaccine. A lot of great progress being made, and a lot of the leadership is happening here in our region. Randall asks, will there be any government help for small commercial landlords who stopped receiving rent due to COVID? Well, I would fully support that, Randall. I think that we have been fighting for that. We passed in the HEROES Act $100 million for housing counselors to provide services like foreclosure and eviction mitigation counseling. We had, I think, $100 billion in emergency rental assistance as part of the HEROES Act. And then we followed up with a letter to leadership asking whereas if we can't pass the entire HEROES Act, we'd like to pass that emergency rental assistance provision. But I'm also mindful of the needs of our commercial landlords and our commercial tenants. And the Paycheck Protection Program is designed in part to help to hopefully prevent wide-scale delinquency and ultimately wide-scale commercial eviction. And I hope that that's beginning to take shape. We also changed the percentages I mentioned a minute ago with regard to the PPP loans in terms of the percentage that can be used for things other than payroll to account for the fact that in some parts of the country and in some businesses like restaurants, rent makes up a bigger percentage than in other parts of the country. So now you can use 60% for payroll and the rest can be used for things like rent. So you add all that up, and I would hope that we can do what we can to help stabilize the commercial landscape in the country. But I know that it's a challenging time. I was talking to a commercial real estate agent over the weekend, and industrial properties are still doing quite well in our region, but there is obviously an impact on things like retail and other commercial business spaces that as more people are teleworking, as more people are doing everything virtually, the need for that space will decline to an extent in those industries where they can move to things like telework. But point is well taken. Sam in San Juan Capistrano says, Orange County's Chief Health Officer, Dr. Nicole Quick, resigned Monday night due to pushback and threats she faced from some members of the Orange County Board of Supervisors and a minority of residents for her order to require face coverings for the public. With a steady to sharp increase of coronavirus cases in Orange County, Dr. Quick's sudden departure is especially troubling. Even more troubling are the actions of the Board of Supervisors who question the need for masks in public, even as more businesses are being allowed to reopen. Is there anything you can do to see that Orange County does the right thing and joins San Diego and Los Angeles counties in keeping the mask requirement in place? Well, I can tell you, Sam, that I have been following the testing numbers. That's where I've been most engaged. And also, I've met with the 3 people, either in person or virtually, that have been responsible for Orange County's COVID response, and all 3 have resigned in the course of the last few months or moved on to other things. And of course, I saw what happened with Dr. Quick, and I've spoken over the months in a variety of meetings and have heard from her and from others. And I think that I'm looking at it with a unique perspective because I get the data every weekday from San Diego County and from Orange County. And we know that the baseline of what we're supposed to be doing in terms of testing is 152 tests per 100,000 people per day administered, not capacity for them, but actually doing those tests. And when you talk to San Diego County, they're running, 3, 4, 5, all the way up to 6,000 tests a day. And they're also proactively trying to test asymptomatic individuals at higher risk, including in people like in your facilities, Dr. Steinberg, in nursing homes and in food processing and in other high-risk populations. I know from my conversations with law enforcement and with our superintendents for our schools, they need testing as well. Our teachers, our nurses, our law enforcement, our frontline workers, they all are going to need to be tested, not just when they are symptomatic, but also as higher risk and asymptomatic individuals. They are going to need to be tested. And the frequency of those tests, I'm not an epidemiologist, I'm not an expert, but I trust the experts who tell me that you want to test different people at higher risk, even if they're asymptomatic, to try to prevent further community spread. What I've seen is, while San Diego has been very proactive, Orange County, unfortunately, has trailed. They've trailed in terms of the number of tests that they're conducting per day. Now, you combine that with the fact that over the last month or so, we've seen the number of cases and the number of deaths in Orange County exceed the number of cases and the number of deaths in San Diego County. Remember, both counties are relatively the same size, about 3.2, 3.3 million people. And coupled with the fact that we see resignations now from the 3 people running the COVID response, and that does cause concern, and it means that we have to keep a very close eye on what's happening. I am there to be a partner. I am there to support anything that we can do at the federal level to help them with testing, to help them with contact tracing, to help them bring federal resources to bear to get this right. At the end of the day, we all want the same thing. We all want to reopen, and we all want to reopen safely. And I'm a believer that we've got to follow the public health guidelines to reopen safely. And if we don't follow the public health guidelines, we're going to be back where we started, which is not good. And I guess, Dr. Steinberg, I would only ask you if maybe you could comment on the need to test more people, particularly in nursing homes.
Yes, and I would just say San Diego County is doing an excellent job of getting out into nursing homes. I'm pretty confident that by the end of the month, all of San Diego County's nursing homes, and we have about 90 or so, all of the residents and all of the staff in all of those nursing homes will be tested. Our county health department's doing a great job. And, just as far as Dr. Quick, I just need to comment. It kind of sickens me that, an excellent, dedicated public servant would feel compelled to step down, at least in part due to actual threats of violence. And some of our San Diego County listeners may not know the story, but where, somebody said, well, we're going to get a bunch of people to go over and wear masks and do exercise on your front porch. And then when somebody collapses and dies, we're going to, send all the cars with lights and sirens. And if she dies, it's going to be first-degree murder. And I mean, just flat out bullying. And I just think that's super unfortunate. It should be clear to anyone that these healthcare officials are doing what they can in the interest of public safety. And it's just so unfortunate, the climate that we're in right now, where people feel, due to politics, that they have the right to just make outrageous threats. And I don't know, it's disturbing. And I just wanted to pay my respects to Dr. Quick, and I wish her the best in whatever the next chapter is for her.
Well, thank you for that. And I share the respect and appreciation for those in our public health community who are doing a really tough job, particularly during a global pandemic. Next question for you, Dr. Steinberg, from Matt. This is another one that's probably not too easy to answer. After all the time that has elapsed, why aren't N95 masks widely available? And all I would say, I'll take a stab. We have sent so much money for PPE in every bill that we do, whether it was the first bill all the way back to March 8th, then the second bill, the third bill, the fourth bill, we have sent tens of billions of dollars to the appropriate agencies in charge of PPE to produce those masks. We have called time and again for the president to invoke the Defense Production Act to get those masks produced. We had the Vice President of the United States brief us in Congress, tell us face to face on multiple occasions they were going to get hundreds of millions of masks produced. And yet here we are, and we still don't have N95s. And I will not wear an N95 until I know that our frontline medical professionals have them. And that's my own decision. Some of my constituents don't like that decision, but that's how I feel about it. And it's unconscionable to me that our medical professionals and those at highest risk would not have N95s. So we have a number of efforts in Congress to try to redefine who's in charge of the strategic national stockpile. We're trying to get to the bottom of what's happening with our supply chain. We need to make more of these masks in the United States of America. And it's unacceptable to me that we rely on an international supply chain and that governors, not the federal government, but governors are expected to do the heavy lifting of negotiating into an international supply chain. That should never be the case. We can never allow that to happen again. And I hope that as we roll out the next bill, the next COVID bill, there will be more specificity about domestic manufacturing, because I know it's something that we all in Congress want to see happen on both sides of the aisle. And it's not a partisan thing at all. Let's make it in America. Let's get it done. Dr. Steinberg, anything else on N95s?
Well, I'd say the shortage has gotten somewhat better. I think hospitals in general in California have had enough, although many hospitals are reusing them. They're not really meant to be reused, but they really don't want to be in a situation where they run out completely. And same thing, nursing homes are still, some of them are still struggling with adequate supplies and are having to reuse them. I know that Governor Newsom did strike some kind of a big deal to get, I can't remember how many hundreds of millions of units. So I hope those will land soon. But I totally agree with everything you said about, it seems like this would be a good time to bring some production back to the United States and put some of the many unemployed people back to work. So I appreciate your efforts in trying to make that happen.
Amen. Amen, Doctor. Thank you. Karen in San Juan Capistrano has a non-COVID related question, but I love this question, Karen. She says, the Senate is in the process of considering S-3422, the Great American Outdoors Act, and appears ready to pass it. The House has a bill that would provide permanent funding for the Land and Water Conservation Fund, a bill that you have co-sponsored. Absolutely right. If the Senate bill passes, what do you anticipate will happen with the House bill and any reconciliation between the two bills? Well, Karen, this is really a great thing that has happened, which is despite the fact that we're in a very polarized time, both the House and the Senate, it appears, are going to come together and permanently fund the Land and Water Conservation Fund. This is a big deal. This is something that's sitting on the House Natural Resources Committee and on the subcommittees that have been looking at LWCF for years. This was something that, originally the Trump administration budgets wanted to cut, I think, 97% of the funding from the Land and Water Conservation Fund, which would protect so many of our public lands in perpetuity. And now, thanks to a unique series of circumstances where we had strong support for it in the House and where two senators who candidly were at risk, Cory Gardner and the senator from Montana, both of them pushed and the administration agreed, and the president tweeted that he would, of course, everything is a tweet these days, but he tweeted that he would, support the effort on the Land and Water Conservation Fund. So I'm ready. Let's get to it. Let's get it passed in the Senate. Let's get it passed in the House, or let's get it reconciled and let's get it on the president's desk for signature. And I think in terms of timing in the House, obviously the balance of June, we're going to be focused on the Justice and Policing Act that I referenced previously when we had Dante on, as well as some other initiatives this month. But I'd like to think we can get it done quickly and certainly get it done when we're back in July during the appropriations season, if nothing else. But thank you for that question. And I'm excited, Karen, about that bill. Ashley asks, are the public schools going to be fully in person in the fall? If unsure, what is being discussed as options? Well, every school district is going to have to do things a little bit on their own in terms of they're going to get guidance from the California Department of Public Health. In fact, CDPH put out, I think, around a 70-page report or guidance manual the other day. It included a lot of different things. But what I know from our local schools is they're looking at thinking out of the box. One concern is that if you have students at home, obviously if their parents need to work, you can't have unsupervised children at home. So for younger children, keeping them 5 days a week in school is really important. And if you keep them in school 5 days a week, you have to have your class ratios lower. So maybe like 16-1 instead of 32-1, or something smaller, so that you can maintain your social distancing with the classes that exist, the infrastructure that exists. Also figuring out how you integrate things like physical education and other subjects in a socially distanced environment. Every district's also going to have to make their decisions around things like masks, around whether the students wear masks or not, the teachers, whether they wear masks or they wear face shields or things like that. That has to be determined. And then obviously when children are running a fever or when they're symptomatic, making sure that they're not infecting others. And that requires a partnership between parents taking temperatures of their children, as well as perhaps the schools having temperature checks. The challenge is those temperature check machines, that not a thermometer, but an actual machine that you would walk in and stand in. Those are really expensive. So for schools to invest in that kind of technology is hard. So a spot check thermometer, a forehead thermometer, temporal thermometer, is a lot cheaper. But think of the long line already that exists when you drop your kids off at school in the morning, and think about how much longer and how much slower that line will be when everybody needs to have their temperature checked and cleared before they go on campus. A lot of this is, to be worked out. There will be obviously a distance learning component as well. I was very grateful for the distance learning that was done and conducted in our school district here in the Capistrano Unified School District for our kids, and very, very grateful to our teachers. But every district's going to be a little different. And the last thing I'll say is that this is all going to cost money. This is going to cost these schools and these school districts money for equipment, money to meet these ratios, money for the tests that'll be needed as well. And, they need more money at a time when the state wants to cut education funding, has to cut education funding because of the deficit that they're now running. Remember, before COVID, the state of California was running a $21 billion surplus, and now they're projected to run a $54 billion deficit. So this is yet another reason why we need more federal support for state and local government, because our school districts are going to need additional funds to figure out their reopening strategy. So as if we needed any more reason, right, Dr. Steinberg, the schools are going to have to spend more to reopen. Anyway, I will continue to be a strong advocate and ally of all of our great schools and our great teachers. Letha asks, I am deeply concerned that the spa industry is being unfairly left out of the reopening plan. We are small businesses that cannot afford to be forced to be closed longer than restaurants, hair salons, and all the other businesses allowed to reopen. Our team is made up of individuals that largely live paycheck to paycheck. If it is safe to get a haircut or a teeth cleaning or eat in a group at a restaurant, then it is equally safe to have a massage with precautions. If the state will not allow us to reopen our business, then we need additional financial and legislative support. Well, what I would say, Letha, I haven't thought too much about your industry, but I think we have to obviously listen to our public health professionals, and the state, Governor Newsom and the State Department of Public Health will make the determinations around which businesses will reopen and when. And I'm not an expert on this, but I would suspect that there are concerns that they're trying to address with regard to the contact being made between the customers and the employees, and they're trying to figure out how to do it right. And I'm sure they'll offer guidance in the weeks ahead. And if you have any need for federal assistance, the PPP loan program, or any other assistance, don't hesitate to be in touch with our office. Amy asks, I know and have heard of many people who are making more money off of unemployment than they were previously making before COVID. Now their jobs are offering them to work again, and they are saying no because they are making more money staying home. What is going to be done about milking of the system so the money is truly there for those that need it? Well, I've heard this, Amy, and I understand your concern, and I share your concern. I think obviously what had to be done at the time that we passed the expanded unemployment insurance is we had to make sure that the amount that people would be receiving would be sufficient in a place to live like Southern California, like New York, like any of the major cities or higher cost areas of the United States. So that is what we tried to do. I know that the expanded unemployment insurance benefits are set to end. They're going to be ending this summer unless we pass another bill that includes an extension, which I would support. I think we're going to need an extension, and I think we have to be realistic that we haven't won the battle with COVID-19 yet. We still are in a major recession. While we see positive and encouraging signs, we don't know exactly where we're going to land. Now that we see the projections from both the CBO and the Fed, we know that things are going to be tough for quite some time. So I hope we don't take our foot off the gas at a time when lives and livelihoods are still at stake. Kathy in Carlsbad says, my question is about how much attention is being given to the numerous people seen walking the boardwalk in Carlsbad that are not wearing masks and are not socially distanced. I'd love to resume walking my dog in this area, but don't feel safe to do so. Are people without masks being fined, or is wearing a mask voluntary? Well, in San Diego County, I know that people who are not wearing a mask can be cited. They can be excluded from businesses or from other areas. Although the different jurisdictions are treating things not all the same, obviously. And I'd like to see some just good common sense, I think, is what we need. We know, and maybe Dr. Steinberg, you can elaborate on the importance of wearing a mask and why we know that it limits the rate of infection.
Yeah, I would just reiterate that there's really no danger in wearing a mask, as some people have disseminated on the internet. If you don't have serious lung problems, there's really no danger in wearing a mask. It clearly reduces your probability of transmitting a disease to somebody else, and it also, to some extent, will prevent you from getting it in. Although it's the size of the mesh or whatever is not going to be enough to keep out all particles, but it will reduce it incrementally. And if everybody wears a mask, that makes things a lot better. So I understand the concern. I share the concern, but I don't know that there's a simple answer to it. I don't think it's reasonable to, throw people in jail because they're not wearing a mask or anything along those lines. It is an order. It's considered to be mandatory. I have not heard of people being actually cited for it. Maybe that's happening. But I think ultimately it's just like everything else. You just have to be careful yourself. And if you think that you're at high risk, then maybe the boardwalk in Carlsbad is not the best place to be walking the dog, because there are obviously going to be a lot of people that you're passing. That being said, you have a pretty low probability of getting it just by passing somebody on a boardwalk. But if that person sneezed right on you or something, that could be a problem. And you never know when that sneeze is going to come. So I sympathize. I think it's that whole fine line that we walk between public safety and personal rights, I guess. Some people really feel that it's their right to go around without a mask, even though that's what is recommended for prudent, law-abiding citizens to do. And I just encourage people, whether you like it or not, just bite the bullet. You're helping the community. You're helping our country.
Thank you, Doctor. Well said. And thank you for reminding our viewers and listeners that not everything that's on the internet is true. Florence in Oceanside asks, my concern is for those who are disabled and facing evictions. What are the laws protecting the mentally and physically challenged in relationship to COVID-19? How are they protected from being an addition to the homeless? Great question, Florence. And I guess a multifaceted answer. One is that Governor Newsom has done quite a bit with regard to banning the enforcement of eviction orders for renters impacted by COVID-19. I think that's a great step. The CARES Act, I know, provides property owners with federal subsidy opportunity to have forbearance. And I think some of those protections are set to expire, but nonetheless, there are some protections through the California Judicial Council, a moratorium on evictions, and basically not allowing courts to process evictions for some time until after the governor ends the state of emergency in California. I think that there are additional steps we're going to have to take, and particularly for those who are mentally and physically challenged. I think we have to take a deep dive on mental health in the country, and that's something that expands far beyond the scope of COVID-19, but nonetheless something that I'm very involved in through my work on the House Veterans Affairs Committee. One thing I will mention is that this past week we introduced two major bipartisan veterans bills, and I bring them up because one of them I think directly addresses homelessness among veterans, and we know that mental health and homelessness are related to a degree. The bill that we're passing creates a waiver for the VA to more directly deal with the homeless veteran community. And that's of particular importance here in our district because we have several hundred homeless veterans throughout the district. And I also know that those with a other than honorable discharge have not been able to receive the mental health services from the VA that they otherwise would be eligible for. So our bill tries to address that as well. The other bill is on rehiring and job training. We're creating a rapid retraining program for veterans. And, we know now of the 42.8 million veterans that have lost, or I shouldn't say lost their jobs, but have filed for unemployment. 42.8 million Americans that have done that. Over 1 million are veterans. And so to the extent that we can rapidly retrain and rehire our veterans in jobs that are at high demand, I think the better off we'll all be. So I'm really proud of those two bills. I worked on one of them with my friend Gus Bilirakis of Florida, who's the ranking member on my subcommittee, and the other one with Dr. Phil Rowe of Tennessee, who's the ranking member of the full House Veterans Affairs Committee. And there's a lot of work happening for our veterans in Congress right now. It's one of the areas of great bipartisan consensus and agreement. So I think for now, Doctor, we've got all those questions answered that we've been asked. So that's pretty cool. I will turn it over to you to see if you have any concluding thoughts this week on COVID-19.
I don't think I really have anything to add. I appreciate your including me in on these town hall meetings, and I very much appreciate all the great work you're doing. And please keep that up and stay safe.
Well, thank you so much. And I guess two other things that I'll mention for our viewers is this past week I was able to announce that we got $11.5 million in federal funding through the Department of Transportation for the Delmar Bluffs. And obviously our residents up and down and really all throughout Southern California, that's important because of the rail corridor that runs from Los Angeles to San Diego, one of the most traveled in the entire nation. We've got $11.5 million to stabilize those bluffs. We're going to need a lot more. We also, for those of you who saw 60 Minutes this past weekend, there was a story on the Tijuana River Valley and pollution there. I'm very proud of the fact that we were able to work with our friends, both Kevin Faulkner, the mayor of San Diego, mayor of Imperial Beach, Serge Dedina, and our friend Mark West down there, so many others, and our San Diego congressional delegation to secure through the U.S.-Mexico-Canada trade deal $300 million. And if you saw that story, you know that $300 million is not enough, but it's going to get us a long way with the wastewater infrastructure projects that we need to clean things up down there. The last thing is a couple days ago, I was able to call the North County Transit District and let them know that we were able to secure $94 million under the CARES Act specifically for them to make it through the pandemic. So very proud of those local wins for our transit district, for our coast, and for our water quality. And we're just going to keep at it one day at a time. And we're going to be focused on our community first. I want to thank everybody for joining us this week. I want to thank our friend Dante Pride from the Pride Law Group. And I want to thank Dr. Karl Steinberg. As always, please follow the recommendations of our state, of our CDC, of our counties. We hope that everybody is safe and is healthy during these crazy, difficult times. And we're grateful for your watching us. If you need anything at all, our office stands ready to assist. You can visit us at mikelevin.house.gov, where we have also included a COVID-19 resource guide that has everything you've ever wanted to know about the federal programs that exist. I'm grateful to my whole team, our great chief, Kara in DC, Eric, our communications director, Francine, our district director. The whole team is doing a great job, our legislative staff. And I think we can get through this period of time. It's obviously a difficult time, but if we listen to one another, if we advocate for one another, if we speak up loudest for those who need the most help, then I think we're going to bring about real change. And I'm grateful for everybody in this district and the help to do that. So thank you for watching. We'll see you next week.